Did your dentist ever tell you you need a surgical extraction? Now you are scared like hell. How am I going to have that tooth removed? Do you want to find out? Stay tuned. Hi, my name is Dr. Kumar Vedivel. I'm a board certified periodontist and a dental specialist and a British trained oral surgeon, been practicing over 3 decades. One of the main questions when patients get referred to me from their family dentist to our dental specialty office for particularly wisdom teeth removal, one of the biggest questions that they ask me is, as soon as they see the tooth kind of sitting in sideways like this or sitting in sideways like this on the other side, Doc, how are you going to even remove it? And how are you going to even pull the tooth? And I joke with them and saying, hey, I don't yank the tooth out, or I don't pull the tooth. I joke with them and saying I gently remove the tooth. And that is exactly what we do, and that is exactly what we were trained in dental school as a surgical specialty, how to gently remove the tooth. It's just not a matter of yanking the tooth away. And I again joke with my patient, if you're looking for somebody to yank your tooth away, I'm not the guy. So as I said, we gently remove the tooth. And then some people, like I said, Doc, do you mind if I ask you how do you gently remove the tooth? And I said, sure. And a lot of patients ask me this question. I thought it'll be interesting for you to know how we gently remove the tooth, and let's see. So for example, right here, so this is the tooth on the bottom right side. That's a wisdom tooth. And as you can see, this is kind of going sideways. All the other teeth are kind of straight like this, and this is going sideways. And then look at the tooth on the other side, right? So all the other teeth are straight like this, and this is kind of like crooked like this. And look at the curved root that you have right here. Yeah? And look at the other curved root right here. So if I'm going to remove the tooth in full, like one, I cannot remove it. And if I'm trying to remove the tooth, I cannot remove it in total, like one piece. So we have to really make them into small pieces to be able to remove them. So what I generally do is I make a small cut. As you see in the red line here, I gently remove that front part. And then again, I make a small cut here after we open up the gum line, and then I make into two pieces, and I gently remove the bottom part and the top part above those two green lines here. And again, on this side right here, on the left side of the patient, and I make a small cut, I remove the tooth, and then I make a small cut here to remove the front part and the top part, the back part here. How about the top teeth? These are like very straightforward, and we kind of again gently kind of put some force and wiggle, and no yanking. So just gently remove them. Again, on the top right side, again, it's a pretty straightforward. We call it as a peekaboo. So this is just kind of stuck under the gum line. We gently elevate the gum tissue, just kind of peek under the gum line. I gently remove the tooth. We just now finished the surgery on this patient with that curvy root, and remember earlier I showed you the curvy root on the x-ray. Right here, this is the curved root right there. This is the curved root. And as surgeons, and because we have been doing this for a long time, we could predict, and this is going to be like a little bit of a difficult extraction. Exactly how the tooth came out, you could see the curvy root right there. And this is the other curvy root. And because they were so curvy, they kept breaking and breaking. We ended up removing the tooth in pieces.